talking about backflow. It's been out for 20 some years. There's plenty of good solutions to stop it. CDC gives warning. Don't ever close around straws. There's not an office I go to that they're either surprised that backflow exists, or this is the first time they've heard of it and they need me to prove it to them. And I can't comprehend why we're still talking about something that is it's not rocket science. You know, it's just like when you drink out of a straw, it goes back and forth, and this is with air pressure used over a patient sometimes. And I think if more people knew about it that were the public or the patients, they would demand.
Well, I don't know why it's not on a CDC checklist, because we have taught our patients to close the mouth. I was a dental assistant. I was a hygienist. We taught our patients to do that. That's the worst habit we ever did, but the patient doesn't know what's going on. I've actually been in an office where the vacuum system got clogged and shut down, and it was going back into the patient's mouth. Yeah. And like, oh, I was a wreck. I've had some experiences. I just think I'm being tested from above sometimes. But yeah, backflow is important. It's valuable information. All I can say is I think either we need another study on it, and it needs to be out there. And these doctors are so involved with the new technology that whomever is in charge of their infection control is not aware. Because it's been out there, what, for 20 years now? How long? If not more,
The original studies, I think Dr. Chris Miller came out with the original studies like in 1993 or 97. I mean, it's been years, and then they've been duplicated over the years, so everyone knows it's there. The interesting thing is, you know, your HVE and then your saliva ejector they work off the same line. You know, there's a misconception out there that, well, this one's on a different line or a different back. They connect to the same chairside trap. You know, so I hate to say it, this has backflow too, and no different than a saliva ejector, just has a little bit more power going through it. But
so my question to my teams are, how long have you owned your practice, and how long have those hoses been there? And it's usually 30 to 40 years, and I'm like, really? Well, even a 40-year-old artery is going to start getting smaller. And when you think of the saliva, the blood, the debris, the amalgam, all that's getting in there, no, it's clogging. It's going to fill up the sides, and it's going to make it smaller and make your suction motor run harder, and it won't last as long. So there's no studies on how often you should change those hoses. And my idea would be every 5 to 7 years.
Yeah, it's actually sooner than that. So when you call a manufacturer of some of the tubings, they'll tell you every 2 to 3. And the reason is it's the harsh cleaners that are on the exterior surfaces. So when you're wiping it down with like an alcohol-based cleaner, it eats away. You know, think of an O-ring, it loses its pliability. This is supposed to be flexible. So all of a sudden your tubing that's supposed to have some flex and work with you is stiff. And, you know, you come into some offices, you can hold up here and it's stiff. So to work, you have to bend, and we see it all the time.
Jim, what about the part that sits on the floor and is in a U shape? That's where I think a lot is sitting, that would really cause an issue because it's sitting on the floor. It's not running straight down into the suction.
Yep, so what happens is when you hang it, obviously it hangs vertical.
Yeah.
The tubing drapes to the floor, and then what happens is because the suction's turned off, all of the sludge drips and it settles down at the bottom, and you'll hear it. So when you turn on your suction, you'll hear that immediately slushing sound, and that is all the junk from here that gets sucked right back again. So there's a misconception with everyone who says when you flush a line, so after a patient leaves and you flush it, they think it's spotty clean. It's not. It's completely lined. It's just like Drano. You know, I sound like a robot sometimes when I talk about this, but there's not an office I go to that I can just open this up and see all the remnants of blood, saliva, spit, because, you know, these are connection parts. Your detergent doesn't get in the nooks and crannies. It's just opening the line. It's making sure it doesn't clog. It's making sure it doesn't harden, but it's not getting in there and scrubbing the sides. It bubbles, but it's not going to make it squeaky clean. So, you know, when it settles, it's all the junk settles. And if you leave for a weekend, or especially now, if you've left for 2 months, that's what all of the Shines, Patterson, Bencos, they're sending out service, how to get these chairs back up. And a lot of it has to do with evacuation, because your evacuation, so much junk can get hardened between here and the back room that you really need to flush it a few times, hot water, warm water, and do it repeated times just to clear them out. But more importantly, if you're still using traditional valves, don't tell your patients to close, especially now. And you know, when you're cleaning the valves, take them out, disassemble them, run them through a sterilizer to keep them clean. Make sure they perform. You know, there's not an office around we go to where these things don't stick. Cups get lost.
Yeah, then the saliva ejector falls out of it too when it's worn too bad.
Yeah, and that's our new product. The new one, it's connected. So now it doesn't come out, it's stuck. It has the backflow flapper in there. It's got a great straw here, the white one, which is, we've evaluated like 6 straws out there. We really like this one. And it fits right on the same connector, and we're giving away 25 free to any office around. So most people contact us and they want to put an order, and we said, all right, that's great, but we're going to throw in 25 free right away, because during this